What the heck is gas station heroin?
Find out today on Medical History Mysteries.
I couldn't wait for this week's medical history mysteries because I heard of gas station heroin and I'm like, what the heck is that? I need me some Tom Viola to shed some light. What is going on now?
And the last time I filled up my car at the gas station, I thought I was on heroin when I saw the gas prices. I mean, my goodness,
Seriously.
out of control. I mean, what the heck? Anyway, enough of that. Let's talk about gas station heroin, or Tianeptine, as it's pronounced, folks. So what is tianeptine? It's so ironic to be talking about this, because you and I talked about opioids extensively in the past. And now what we find is what's rather, curious to me is that a lot of compounds that were produced in the 60s and the 70s, and, these were synthetic opioids that were discovered, they were researched, and they were put on a shelf, basically, maybe not literally, but certainly figuratively. And as, oh, well, we're not going to use that. That's too addictive. It's got too many side effects. It's not a good drug. Let's pursue something else. So it's like you found it, you isolated it, you realized it didn't have much use therapeutically. The benefit was outweighed by the risk. Stick it on the shelf. We'll worry about it another time. But see, someone came along now and said, hey, check this out. And so tianeptine is one of those drugs where it was discovered in the 1960s by the French Society of Medical Search. Okay, that's exactly who discovered it. And it was actually sold as a prescription drug, marketed as an antidepressant, and not just in France, but in other countries as well. It's still being evaluated as a potential treatment for persistent depressive disorder, bipolar disorder, or even some adjustment disorders. Now, here's the thing. In countries where it is legally prescribed, not here in the US, because it's not approved for use in the US, tianeptine is typically prescribed at 25 milligrams to 50 milligrams per day. Now, take it as directed with those doses, you still get side effects. You get stomach upset, constipation, maybe some headaches, nightmares, xerostomia. In the United States, one company, Tonix Pharmaceuticals, did a phase 2 study. And they reported, like other forms of medication available in other countries, which require 3 doses a day, their version of the pill would be a once-a-day dose. Again, they're still waiting for this study to be completed before they can go to phase 3 and ultimately seek FDA approval. So at the end of the day, tianeptine may actually be a drug that is sold as a prescription drug and has great uses and maybe helps those people with those types of conditions. The problem is, because tianeptine is not approved for use in the US, it came here as a dietary supplement. Now, that's illegal. You can't do that in the US. You can't take a prescription drug and market it as a dietary supplement. But a few companies did. And because it was marketed as a dietary supplement, it was sold in places that were considered to be non-traditional places to buy things like that, like smoke shops, convenience stores, and you guessed it, gas stations. Okay. And I don't want to name the actual names of the different products because, it wouldn't be fair to those companies. I'm sure there's some litigation ongoing right now. But let's just say you could have got tianeptine at a gas station. Okay. So what's the problem? If it's used to treat, depression and other things, maybe that's a good thing. The problem is, first of all, it's not legal in the US. Second, it should never been marketed as a dietary supplement because it's not. But third, people found out quickly that you can misuse the substance by taking it in very high doses. Now, again, to remind you, the dose was 25 milligrams to 50 milligrams per day, typically. Some people were taking doses up to 7,500 milligrams.
Whoa.
And at those high doses, tianeptine mimics the effects of opioids. So there you have it, my friends, okay? Much like our old friend gabapentin, which I've spoken about enough to fill a novel, tianeptine, just like gabapentin, in high doses can mimic opioid-like effects. Now, think about this for a minute, because tianeptine is not an approved drug in the US, okay? It's sold as this dietary supplement, I can use tianeptine to get my opioid high, and it may or may not show up on a urine test from my employer because maybe they're not looking for tianeptine as a drug to be looking for in the first place. So it's these drugs that sort of fly under the radar that become problematic because if I can get this at a gas station, I could be any age and buy it at a gas station, even a child, because I'm relying on the gas station attendant to determine whether or not he or she wants to sell it to me. So that's why I think these drugs are scary because they're drugs that were discovered at one time years and years ago. People sort of forgot about them, but now they've reemerged in this ever increasing, demand for opioids.
I'm blown away. I'm blown away by a few things. Number one, I feel like it's human nature to be entrepreneurial, even if it's illegal or not. And I also think that it's human nature to kind of create any sort of not natural human nature, but it exists obviously to take any sort of medication, supplement or something and figure out an illicit way to make money from it. But I don't mean to be judgy, but why would you get supplements at a gas station?
Well, I know one reason why, and this is
Why?
maybe the most unfortunate thing, and it's because tianeptine, if you go online and do some even basic research on it, you'll find that there are many, many claims that tianeptine can be used to treat opioid use disorder. And so the heartbreaking thing about this for me is that people may have sought out this drug because they knew they were addicted to some opioid, whatever it was, and they decided to self-treat their opioid use disorder, to self-medicate. But that's not an easy thing to do because you can't just get the drugs used to treat opioid use disorder just anywhere, right? You need a prescription, you need to be seen by a doctor, and maybe I don't want anyone to know. But all of a sudden, somebody tells me there's this stuff I can buy at a gas station that'll help treat my opioid use disorder without anybody knowing about it. Count me in, and I'd be willing to pay anything for it.
Wow. So I guess lesson learned, know what's in the ingredients of any sort of supplement or any, I mean, we're going to call this an over the counter, right? That you're taking. And also educate your patients. Look up what they're taking. If they're saying they're taking a supplement for something, dig a little deeper and try to find out what's going on because I guess the next best thing around the road could be something completely unsafe and illegal. So this is a great opportunity for us to help our patients and to even help ourselves if we're taking something like this.
Once again, Pam, like the economist once said many years ago, it's the economy, stupid. My version of this is it's the medical history, silly. Take the medical history and use it as a tool. And that way, you know exactly what your patient's doing, what they're not doing, and how to best elicit a treatment plan for them.
Wow. Well, now I know about gas station heroin. So mission accomplished for the day. So thanks for this. And I can't wait to hear what's in store for next week.
Thanks, everybody. Take care.
See you then.